Thanks so much for the opportunity to speak at this exciting session. Sorry, I was in another session before this, so I didn't hear the whole thing. I hope I don't overlap too much with some of what the previous speakers have talked about. But I'll share with you, I have no disclosures that are pertinent to this discussion. So over the next few minutes, we'll do a review of a few cases. I'll talk to you about some of the advantages of social media and the disadvantages of social media, some of the pitfalls, and then some of the guidelines for using social media that exists so that we can all do this mindfully and use this mechanism to the best of our professional abilities. You know, so my fellow from a couple of years ago went into practice down in Lubbock, Texas, and he realized that he came there with a skill set that nobody in Lubbock, Texas really knew anything about. And so, you know, he was kind of in an isolated situation, and he'd be faced with these super crazy problems, and he would call me frequently, and then started using the Facebook page for basically outside consultations to help. And so just sharing with you some of the problems that vexing problems he posted. This is a 45-year-old woman who had a sleeve a couple of years ago. She comes in with nausea, vomiting, dysphagia, reflux symptoms, and basically, you know, talks about the manometry, which is the whole session that's happening next door right now related to bariatric surgery, and what were some of the comments about this, because there's really nobody at his institution who is doing real foregut surgery at this point. He didn't even, before he got there, have access to a manometry lab and had one started there. So, you know, so he was able to then get some questions, and he was sent 1 million replies. He got so many solutions and suggestions from people all over the country and all over the world, and was able to kind of have an online conversation with them. And so despite being in an isolated situation, this became a great way for him to be able to communicate with those outside of his local place, where you can't say to your partner, hey, can you come and take a look at this? He was able to reach out to a bigger community. This is another follow-up patient that he posted, obviously kind of a long thing, but if you look at the pictures to the right, he's able to post endoscopic pictures and then get a bunch of solutions and a bunch of suggestions again afterwards as to how can you address this problem, what are some different options for taking care of this, and how can we best help this patient, as this was a complex issue. So really, this has really provided a great way for him, and he said that I could quote him directly. That's why his name's not blocked out. But he, you know, but this has been a great mechanism for him to get other consultations. And many people have started to use this because we all see complex things that are not straightforward in our practices every day. And you can see there's a whole nother page of comments. Some people said do a gastric bypass for this patient. Some people said you can just revise their procedure. Some said revise the whole stomach. So many different choices, and you could have an ongoing conversation. You know, this Hope, who's one of our panelists, actually published on when this Facebook group was first posted, started in April of 2015, and by December of 2016, this became a very, very popular avenue for people to use. By then, there were almost 700 members, 411 posts, and over 4,000 comments. So this is a highly utilized platform. And if we look at the categories of the posts, the majority surround operative techniques, people showing how they do it, because we all know that even though they're kind of the textbook way of doing a procedure, we all have certain nuances that we bring to it. And so it's been a great way to share those different techniques. And many, over half the posts were due to were attributed to patient management, and some of it was due to continuing education, networking, and the like, but the majority really had to do with direct patient consultations. So what are some of the advantages of this social media consult, so to speak? We can improve professional networking. We can improve professional education, as Dr. Davis pointed out in the prior talk. You can promote your organization this way, perhaps. Some specialty things that you might be doing that other people may not be offering at other institutions. this may be a mechanism really to say that we can improve patient care because you can get so many opinions, and maybe there's somebody out there who's seen that really unusual case that you just took a look at. And then, of course, you can have impact on public health programs, and we might use forward-facing to the patient type Facebook group to attack disease processes. It also allows us to use crowdsourcing, right? We can harness the knowledge and the skills of a community to solve problems and to figure out how we can put the information together and really generate a quality set of opinions. And I think that's one of the advantages of having this, of course, as a closed Facebook group, right? These are things that you don't want necessarily going out to everybody and anybody, but really those professionals who are involved in this organization that we can all consult and help each other. And it can also be a great way to connect those healthcare providers who are in remote areas who really don't have anybody to talk to about the complex situations that they may be presented with, and allow them to provide better care locally. Now, there are some disadvantages to these social media consults, okay? Because sometimes your responses may not be quality, and it's really up to the user to determine what may be the quality or not quality information. If not used properly, it can be damaging to professionals. There can be breaches of patient privacy. There can be violation of personal and professional boundaries, licensing or legal issues. And so it's really important when we use these groups to really remain professional, okay? You don't want to talk about a patient's personality, their values, their priorities. You really want to focus on the clinical problem at hand and kind of what are your clinical solutions, you know? And you don't want to put forth any perceptions that might not be viewed well in a social media profile. You really don't want to hurt anybody. For example, you might not have wanted to post too many pictures from the sing-off last night, you know? So also, there's an issue of patient privacy. So it's really important that we're all mindful and are HIPAA compliant when we're posting any of these cases, like you've seen in some of the prior talks, that the patient information is deleted from any posts that you have, because you also don't want to breach that relationship and that confidence that patient has placed in you, and the confidentiality that they expect from us as healthcare providers. And really, SAGES put a statement out on this, led by Brian Jacob and Jamie Bittner, and really said that, you know, there are issues of informed consent, patient privacy, and SAGES does have a statement on this, and but that this is a good media to optimize patient care. We can disseminate clinical information, but be responsible in your use of these social media groups. There was really no consensus on informed consent, and really, you know, if everything's HIPAA compliant, they kind of determined that was not necessarily too much of an issue, but no clear distinction was made there. And of course, you never want to discuss a lawsuit online, right? If you have a patient or a situation that you know is you know, undergoing or going to undergo some kind of litigation, again, you want to protect yourself. This is all discoverable, and you don't want to get yourself in a situation that you might not want, because you have no idea. Maybe you might post something that's not damaging, but you never know the responses you're going to get back, right? And then it could get you in trouble. The AMA also has guidelines on the use of social media, and again, promotes and emphasize patient confidentiality, knowing your privacy settings on your social media page, maintain appropriate patient-physician boundaries, always act with collegiality, always be professional, you know, declare any conflicts of interest if you have them when you are posting, so that this is an open and professional discussion and not anything that you would get you in any kind of trouble. So the Facebook groups are a great way to get advice on really complex problems and to get a consultation that, you know, is something that you may not be able to get at your local institution. It's a great way to crowdsource and maybe find somebody who might have seen a situation that's similar to what you've seen, and it's a great way for us to stay connected with our colleagues, but we really have to avoid some of the potential pitfalls of using this type of arena, and always very important that we maintain patient privacy and, of course, remain professional in your posts and responses. Thank you very much.